Hello, everyone. I'm Michael Barr, the Joan and Sanford Weill Dean of the Gerald R. Ford School of Public Policy at the University of Michigan. It is a great pleasure to welcome all of you to this virtual Policy Talks at the Ford School event with my colleagues, Professor Luke Shaefer and Professor Al Young. This afternoon, Luke, Al, and I will be talking about how the COVID-19 pandemic has exacerbated problems of poverty and inequality in the United States, and what local, state, and federal governments can do to help those most in need. Before we dive into the conversation, let me briefly introduce Luke and Al. Luke Shaefer is the Associate Dean and the Herman and Amelie Kahn Professor of Social Justice and Social Policy at the Ford School. He's also a professor in U of M's School of Social Work. He serves as the inaugural Director of Poverty Solutions, an interdisciplinary presidential initiative at the University of Michigan that seeks to partner communities and policymakers to find new ways to prevent and alleviate poverty. He is also serving as a special counselor to the director of the Michigan Department of Health and Human Services. Professor Al Young is the Arthur F. Thurnau Professor in the Department of Sociology and a professor of Afroamerican and African Studies. He also has a courtesy appointment as a professor at the Ford School of Public Policy. He serves as Associate Director of the University of Michigan Center for Social Solutions and Faculty Director for Scholarly Engagement and Leadership at Michigan's National Center for Institutional Diversity. Finally, a couple quick notes about format. We'll have some time at the end of the event today for audience questions. We've received some already in advance, but you can continue to submit questions in the live chat feature on YouTube or tweet your questions to hashtag Policy Talks. And without further ado, welcome, Al and Luke.
Thank you.
Yeah, great to be here.
It's really great to be here with both of you. And we talked a little bit beforehand. This is going to be a very informal conversation. We'll have a chance to have a little back and forth. And I'm really excited for the conversation today. It's on such a critical issue. As we've seen, the COVID-19 pandemic has had really differential impacts on different groups of people in our society. It's hurt African Americans and Hispanics, for example, much worse than white families. It's hurt lower income people more than upper income people. So it really is both reflecting and exacerbating the kind of strong inequalities we have in our society. And it's such a critical issue. I'm glad we could talk about it today. I'm gonna start maybe with a couple questions for Luke, a couple questions for Al, and then we're gonna mix it up. So Luke, you're playing a special role, unusual for an academic. You have part of your appointment actually in the Michigan Department of Health and Human Services. How did your role change there with the onset of COVID-19?
Well, the short answer is completely. It was quite a transition. So I had come on in the fall to work as part of my time with Robert Gordon, who's the head of Health and Human Services for the state, on an agenda around trying to simplify our public assistance programs, make them more accessible to families, increase access, and treat families with dignity. So we were looking at a set of innovations. But the processes in state government can often be incredibly slow, where you have to figure out sort of all of the different departments that have authority over different parts of a program, what's controlled by the legislature, what's controlled by the administration. And when COVID hit, it was such an incredible perfect storm of crisis, really, right? Usually you have a lot more time to ramp up as the economy slows down. And usually jobs might disappear, but schools don't disappear, right? What happened with COVID that was, I think, especially challenging for lower income families, challenging for everyone, but especially lower income families, is that all of the sources of support disappeared almost like that. So the Unemployment Insurance Agency was getting like 500 new applications, new beneficiary, new claims a week. In about 1 week, that went up to 80,000. That was the most we'd ever had in a week. Then it went up to 128,000. Then it went up to 380,000 before it crested. So we were sort of thrown into a situation of trying to figure out a number of things on the public assistance front. One, it turns out a lot of our programs are, there's a lot of things built into them that make them particularly bad in a public health crisis. So work requirements, for example, saying you have to be working when we actually want people to be sheltering in place. That's something we had to address really quickly. And you can say that on a policy front, but then you have to look through all of the different mechanics of where these things get enforced. You know, one example of that was with our cash assistance program. There's a requirement that kids are in school. And we found a couple of weeks after we had said, you know, obviously with schools closed, we're not going to require that. You know, a set of families who were still being denied because they weren't turning in the form that they were going, you know, that they weren't going to school. So we had to go through and sort of figure out what those policies were that could help protect families as part of the public health crisis, right? And not require them to go to an orientation at a Michigan Works agency, not require them to be in school to get benefits, and figure out, is that a matter of policy? Is that a matter of statute? And then the second piece was starting to interpret what was coming down from the federal government. We're on a very tight budget, right? And so we were, you know, I was reading the tea leaves like hour by hour with the first two pieces of legislation, what was going to be included and what would it take for us to administer those things, and trying to do that as effectively as possible. So things that would have taken, I think, 6 months to change, everybody, I mean, it really was impressive, I would say, the team at the agency, how fast they were able to implement a lot of things that I think made a big difference for a lot of families during an incredibly difficult time.
Luke, I think that's a great set of issues, and I might just ask you to hone in on one of them. I know you were very involved in getting food benefits to students whose food access had been cut off now that they were no longer in school. They needed to get access to that food assistance quickly. At least as I understand it, Michigan was one of the first states to actually get that program implemented after Congress authorized new funding in about a month. How were you thinking about that? How did Health and Human Services act that quickly? I mean, a month is a long time in a low-income person's family's life not to have access to that. But almost every state was much, much longer than that. And I wonder if you could talk about that a little bit.
Yeah, there were actually two provisions, and I think they reflect two really interesting policy stories. So the first provision was that it said that we could increase every SNAP recipient's benefit by an amount. And actually, when we read the legislation, when advocates read the legislation, when the Center on Budget and Policy Priorities read it, we thought that it was written in such a way that we would be able to double everybody's SNAP benefit for a couple of months. But in fact, the piece of legislation gets passed, and then guidance comes from the USDA, and the USDA interpreted the legislation as saying we could top everybody up to the maximum amount of a benefit. So families get benefits based on their family size and their economic need. And so the difference between our interpretation and their interpretation was that in my case, if we had doubled everybody's benefits, everybody would have benefited. In the way that they interpreted it, actually families who were already in most need got nothing additional. Mm-hmm. And so, you know, we were sort of put in a position where I didn't think they were interpreting the law correctly, honestly, but they are the final word, right? They're the final authority on this particular piece of it. So we went ahead and had to submit a waiver for that, where we said, okay, this is, you know, how we're going to administer it. We're going to do it this day. You know, we're going to roll it out over a month, you know, a few weeks. And we were actually waiting for a really long time for them to even issue the guidance that will allow us to do it. And then we had to do a waiver to say how we were going to do it. They had to approve it. and then we could administer it. And in that case, once we got to that place, it was fairly easy where we could just shoot money on people's cards, right? These are people who already have cards.
Mm-hmm.
So the second piece was this one about school-age children, right? So the federal legislation, the CARES Act, actually it was the one before CARES, thought, with schools being closed, people not being able to access free and reduced price lunch, we should increase the food benefits of families who are both on SNAP, but those also not on SNAP. So you have a fair number of kids who receive free and reduced price lunch, but don't get food assistance benefits through the Supplemental Nutrition Assistance Program. So in that case, it becomes actually a more complicated thing, right? Where the legislation is saying you have the ability, you can actually provide SNAP benefits to families who are not on SNAP, who are on free and reduced price lunch. In this case, right, we have to communicate with a different part of the state government, the Michigan Department of Education. And we have to compare our records and their records, because the kids who are already on SNAP, we can shoot their benefits right away. But the ones who aren't, who we want to get those benefits to, we have to figure out who they are.
Mm-hmm.
We have to do something to say that we determined that they were actually eligible for SNAP. And then we actually have to get them cards, right? So we're talking about like EBT cards. So that involves both getting federal approval, coordinating across two major agencies of the state government, and an outside provider who is got to somehow give us like tens of thousands of cards in a very short amount of time. So the long and the short of it is, we were the very first state out of the gates in both cases. We were able to do both, and it was, I think, in large part because we had a director who said, I want these things to happen as soon as possible, and sent a lot of sternly worded letters to the USDA trying to move the process along. And we had a staff that was ready to do it. But just like you said, more than a month out, only 2 states had done it. So there was a New York Times article, and I remember both equally being incredibly proud of us that we got our kids those benefits in a short amount of time, and like totally blowing my top saying like, any policy that during a global pandemic can't get like what's actually a fairly small amount of income support to families with kids who are struggling, like that's not a tenable program. And so we need to be looking for more simplified approaches somehow.
I think that's a good point, Luke. And in the relief payments more generally, even beyond the student assistance, there were huge delays in getting funds to very needy people who are lacking in a bank account, and or people who hadn't filed taxes in the previous year. So these huge lags for the people who are the most vulnerable in society.
Yeah.
And I wonder, Al, just to bring you into this conversation now, so much of this is driven by socioeconomic status and also by race. In Michigan, we know that African Americans are 14% of the population, and they're more than 40% of the deaths from COVID-19, which is just outrageous. And I wonder whether you could talk a little bit about the role of race in public policy, and what we can do and what we maybe can't do through public policy to overcome these issues of both intentional and structural racism.
Certainly. And I think, first of all, this moment has caused us, if we dare to do so, to really think more deeply about the relevance of race and policy beyond the ways in which we have done so, at least in recent decades. By that, I mean that we fully understand, or at least many of us understand, the racial disparities around health, around income, around quality of life. But the pandemic has put before us an opportunity to think more deeply about why and how low-income citizens, in this case, low-income African Americans, live the way that they live, and what are the complicated mechanisms that are at stake, and why these outcomes exist. So with respect to the pandemic, it's been made clear almost from the beginning that there are a set of preconditions that position people to be more greatly affected. Right? Health factors, income factors, we get that. But I think we really need to think more deeply about how everyday living in a context of constraint factors into why some of these outcomes exist as they do, and lead us to then make sense of what's going on that may be indirect or may be subtle, but is still consequential for the case of African Americans. I was really intrigued by how much of the people that I talk to that are points of connection for me for research sites in Southeastern Michigan, Detroit, and more broadly construed, and how they responded to how African Americans initially responded to the crisis. So the first order response was check on family, check on friends, family sometimes living at home, sometimes family that weren't. If you were checking on relatives that weren't living at home, you were engaging in a form of social conduct that could exacerbate the spread of the virus, but for the sake of trying to be aware of family being safe, being healthy, being well. It's also the case that African Americans live in smaller residential units and often with more people, so that this notion of social distance is almost impossible for African Americans. Many are living in residential units where they're not necessarily with blood relatives, but it just exacerbates the point of everyday contact that makes it difficult to engage everyday life. Some of us live in environments where the hunker down approach was certainly emotionally challenging, but made easy by access to resources, delivery services, reserve funds, the kinds of things that just aren't in play for African Americans and low-income communities. In fact, they're the people delivering the resources to more privileged folks and thus possibly risking exposure to the virus by having to be out and about more often than other people. I also think a history of problematic relationships to healthcare systems matters as well. So Black people, to be rather general about it, particularly low-income African Americans, are used to living in unhealthy conditions. Blood pressure issues, cardiovascular challenges, that's a part of everyday life. Many neither have the economic means nor the trust and confidence in healthcare systems to try to get treatment for those kinds of conditions. Presents a case for disaster. So I think around healthcare, around the quality of everyday life, around understanding why African Americans make the choices they make around behavior, how they navigate everyday life in a crowded domicile, all those things provide us for more possibilities for thinking more deeply about the experience of the poor and not just simply resting upon the fact that there are disparities out there, right? It's a deeper, more complicated question for us. And we're invited now to really begin to think more thoroughly about what all that means, given the pandemic.
And, as you're suggesting, really trying to get a deep handle on the socioeconomic determinants of health, where the levers of policy might directly affect those, where some set of deeper conversations has to happen about those conditions that people are living in. And, are we going to take seriously our mutual responsibility to the circumstances that people find themselves in? And do you find any encouraging signs that that kind of conversation is possible now in new ways?
Well, I think so. In this case, I think it's certainly up to people like us, researchers, civic leaders, to invite and engage those kinds of conversations. So that for a lot of African Americans, it's clear that they have needs in this moment of crisis. I hear Luke talk about the dynamics that went into play in trying to distribute food, and I was struck by how much of the details at stake were beyond the grasp of many African Americans who simply wanted access to food. Like the policy conversations and procedures that were put into play are far removed from people that are trying to figure out where to address their food insecurity as immediately as possible. And I think that the role in making those conversations happen really rely with us. It demands that we encounter people of more privilege, social institutions that provide services, and try to inform and or remind them that there are behavioral dynamics, there are patterns of understandings that have got to be overcome, such that when we create opportunities for service delivery, the people that desire those services understand the means and mechanisms by which they were created, can perhaps get some better gauge on what might be the most appropriate steps to take on their end, can perhaps come to better understand what kinds of policy exist and why that might factor in some people being excluded or denied at particular points in time. So there's a great deal of understanding that I think that we can deliver around how policy gets constituted and how service delivery gets designed for people that are just simply desperate to get resources and don't have the capacity to pay attention to those dynamics.
That's, I think, a great point, Alan. I think maybe a useful way of bringing both of you together to think about. There's a huge gap between announcing a policy in Washington, legislating in Washington, and then delivering it on the ground with a community. And some of that has to do with the kind of policy nuance and detail that Luke was talking about. Al, some of that has to do with the behavioral response from communities you're trying to help on the other. And I wonder if you guys could talk back and forth with me a little bit with each other about how to bring these things together in a way. How do we get the policy design, the state implementation, channels like the EBT card to work, and the behavioral response lined up in a way that is going to make for a more effective policy response?
Well, I guess I'll just start that conversation. And just to, I think, dovetail on what Al was saying, I think one conversation that's changed a lot has been around access to water in Detroit. So that's been something that my team at Poverty Solutions has worked on. I know a lot of U of M faculty sort of understanding that there's been thousands of families, maybe tens of thousands of families over the last few years who have had their water shut off as we've tried to, as the city has tried to sort of change its policies around that. And I think we didn't understand that as we did, but the system did not understand it as a public health risk factor, right? So when a major pandemic, a global pandemic hits, and there's a set of families who have been without water for a long time, maybe are now or maybe aren't, like, this is a bigger concern, right? This is why people should have access to water. And it I hope has shifted the system towards a new set of policies that will lead to longer term access. And so if we can point to bright spots, it's sort of some of these, right? Where, hopefully we're thinking more deeply and differently about water or housing. On your question specifically, Michael, I will say that there is always going to be a difference between, legislation getting passed and then how it gets implemented on the ground. But my experience so far is, gosh, that road could be a lot shorter a lot of the times than it currently is, right? When we have like policies like this, SNAP one, the food assistance, where we have to wait for weeks for USDA to issue guidance on how a law should be interpreted. And then we have to submit a proposal to them, and they have to approve it. And then we actually have to do it. And we have to work across, thinking sort of over the longer term, gosh, aren't there places where we could simplify a lot of these programs? And one place where I feel like at the state we've had some success on this was that in the CARES Act, there was some increased funds for energy assistance. So this is for people who are facing shut off with their utility bills. And with that money, we did two things, one before we got the money and then one after. The first was our program to get energy assistance was incredibly complicated. It still is, but you had to do a very arduous application. There were copays. It was confusing to people. A lot of the things Al just said, like, I imagine for a lot of people who would apply through that process, it only had a 50% approval rating. So, this is sort of a program that I think sends every message to people that, we're going to make it as hard as possible for you to get aid. So when the crisis hit, we were able to sort of do a review of all of the policies and procedures around that. And we're able to streamline a lot of it. And as a result, the approval rating went up from 50% to 65%. So still not 100. I'm not exactly sure where the approval rating should be, but definitely a step in the right direction. And we hope it became a tighter, faster process, sort of a more understandable process to people. But we also saw another program, a direct pay option, where in the past, about a decade ago, the state had gotten files from the major utility providers and matched it against their own records of people on food assistance or cash assistance, and then just paid those arrearages directly. So we negotiated with the utility providers to for them to send us files for us to do a match, and then we would pay 75% of the arrearage for people that would clear the slate, clear the deck for families, if the utility providers paid the other 25%. And they agreed to that, and we were able to we've now put 41,000 families through that process, and they don't have to lift a finger, right? So basically, they just get their next, imagine if you got your next DTE bill and your balance was at zero, right?
Could be a miracle.
It would be a miracle, right? It's what's happened in this particular case. And I think it's just like one small example in a very complicated system where it is sometimes possible really to streamline these things and like take all of the burden off of the shoulders of the families who, really should be able to spend their time focused on other stuff.
And streamlining is not simply about administrative efficiency. That's what builds trust and comfort in low-income and disadvantaged communities with government, with social institutions. And I think one of the great challenges around even well-meaning social policy that's complicated, that takes time to implement, is that just exacerbates a sense of lack of trust and heightens suspicion and insecurity for people that are in desperate need. The related factor to this, and I'm glad that Luke raised the example that he did with the arrears, is that often we tend to think about these kinds of services as getting people off the hook, right? So if a bill is paid, if money owed is resolved by external parties, then what will incline people to respond in the right way? Understand that for many people, they're living in moments of desperation. A short-term intervention doesn't mean that their response is the government or some external party is going to take care of me forever. Right? There's a desire and interest for people to meet one's needs, right? To go to work, to respond effectively. And oftentimes these moments of crisis intervention get subverted or compromised because the vision of low-income, of disadvantaged people is if you give them, they will want forever. And we've certainly got all kinds of data around response to public assistance, around response to employment opportunities that struggling people try to do for themselves. Right? You'll find a bad apple in every case, but struggling people try to do for themselves. So I'd hope that the national conversation, the state level conversation on these kind of interventions don't collapse upon this vision that if we step in to help people, that means they'll approach us forever with this notion of solve my problems.
Al, I think that's a really good point. And, I know in my own research in Detroit, I spent a long time talking to low and moderate income families. And, the biggest barrier they faced is they just had no financial slack. So any one small thing that the three of us could handle and not worry about was enough to send them over the edge. A medical bill, a car repair, really would just completely upend their lives. So if you're able to intervene, as you were describing, Luke was describing, in a small way, you might actually create a bunch of benefit that lets people then get control over their lives and move forward. I want to switch gears just a little bit and take us into the realm of our role as researchers at the University of Michigan. Some of the questions we got in advance relate to what I'm about to say, and also I know Al and Luke, you've both done a lot of thinking about this. But how do you see your role as a researcher? How do you establish the kind of mutuality that's required for ethical and good research in a community you're working with, and build the kind of trust required for communities not to think that you're coming in and doing a study on them, and you're there actually to try and make things better? How do you go about thinking about these things and working on them?
I can go first this time, given Luke's been in the lead for a little while. Catch your breath. Couple of responses, and they have to do with different kinds of audiences. I think with respect to the actual people that I study, my effort is to be very forward with them, that in fact, I am in this space to study them. I will respond to, address, acknowledge whatever tensions, anxieties, frustrations they have with yet another researcher being in their place. But before the research endeavor is actually pursued, a part of my project is to explain to them why there's value in doing this research. and coupled with some of the things that we've been talking about so far, one of the immediate points I make with them is to say that your life will not change tomorrow, not next week, maybe not even next year on the basis of any research that I do. It'll be a part of a larger effort to make things better. But understand that I am not promising that my being in your space right now means that tomorrow your world will be better. You might receive some, and in all cases around low-income populations when I do research, receive some in-kind or material return for being in my study. But I think being very forward about the fact that we are in this space to understand experiences and situations, and that what we do at these particular point in time won't make their worlds change dramatically in a period of time, creates, I think, an honest buy-in around the project. Now, the other relationship has to do with the policy world. And there, I think very carefully about what it means to be a sociologist engaging those circles. For me, and it goes in line with what I've said throughout this conversation, the point is to really keep in play how people's reaction and responses to policy matter. Outside of, beyond measures of effectiveness, impact, what have you, there are always nuances, subtleties in how people respond. In some ways, because they may not be living in a formal family residential unit, but operate in that context and feel appropriate defining oneself as a parent or a guardian, even if officially they're not. Right? In some cases, having marginal connection to the world of work. So they may not be listed as gainfully employed, they may not in everyday behavior be unemployed, but there's this nebulous but still realistic status they occupy that often falls in between formal policy. So my conversation to the policy world is to promote and acknowledge that there's this greater complexity to the status that people occupy, the ways in which they respond to initiatives, that we just got to keep in mind as we continue to create and measure the effect of policy.
Thanks, Al. Luke, do you want to add to that?
Yeah, I think I would just add, sort of reflecting on Al's new book that I just read about the world of work in Ypsilanti. In my own work, I would say that I think we can do more as researchers to start with listening, right? The way I think Al tends to go about his work, and I try to emulate a lot of the time, is saying, let's not go in as researchers and assume we know exactly what the right issues are, right? Exactly the things that are people are struggling with, but start with doing a lot more listening and let our agendas be sort of shaped by that. And I think we can do that a lot of times with policy research. So in the work of poverty solutions, we have a partnership on economic mobility that sits at the mayor's office in Detroit, and now this connection with the state government through myself and some of my team. We really try to have our agenda be shaped by what community partners are saying, what residents are saying. Liz Gerber's DMAX survey has incredible questions about Detroiters. It's a representative sample of Detroiters that she and Jeff Mornoff are the PIs for, trying to listen, right, and figure out what are the issues that they bring up, and can that drive my research agenda, and try to be responsive to that, right, both in what we do, just in showing that we're interested in listening and sort of being driven by that, and also in our actions. So one of our things, sort of our big issues last year, was around auto insurance, right? And an extremely high cost of auto insurance in the city of Detroit. And that, you know, if I think about all the issues I thought when we started an agenda, sort of an action-based policy research agenda in the city of Detroit, of what people would bring up, auto insurance was way down on the list. Not even part of what I considered, but as we talked to families and people over and over again, it's what they brought up. So we dedicated time to that, right? To try to show that we were being responsive and that we were being driven. And from a policy standpoint, like trying to show some results, right? So if you talk to me as a researcher or you're a study subject, you're not going to get anything. But I can have an obligation as a policy researcher to say, hey, you know what? You mentioned auto insurance. We did this work and we think it was a part of, you know, the bill that passed through that should be designed to reduce people's auto insurance rates. And we're going to check and make sure that that actually happens as that law becomes implemented.
Both great examples. And I know that a lot of the people that you all have worked with over time right now are worried about one of these issues in particular, and that's evictions. And there have been some moratorium on evictions in the short term in Michigan and other states, but these are starting to roll off. I wonder whether you could talk about, how families might be coping in the coming days. What is it that families might do, and I guess maybe more importantly, are there steps that state and local governments can take? Are there things that you hope the federal government will do to step in? We've made it through this period this summer, spring and summer, with a lot of federal aid and these steps kind of postponing, in a good way, the harms, but the harms are just waiting right there to hit us now and in the next few months. So what can we do on evictions?
Yeah. Well, I can tell you what we did in Michigan. So I've played a role with the governor's team as well as MISHDA, the housing agency. So the eviction moratorium rolls out today, and it's not going to be extended. Yep, this is the 15th. But we've done a couple things. So first, the Supreme Court actually has put together, I think, a really nice process. It's sort of an ordered and relatively slow process of taking up evictions back up again. It's going to start with those that are all the cases that are not non-payment related, but health and safety concerns. And then we'll move through sort of the longest term cases and move forward from there. So it's going to be slow, right? And also they're sort of doing a number of things to the process where instead of just having huge batches at one time, everyone sort of will be ordered as it goes. So we can start to work through those. And there's a pause in the process, right? So Tom Boyd, as the administrator for the Supreme Court, designed a pause where people can get access to help. And the state has set aside $50 million. So we have a pot of money that's $50 million, where those are going to roll out through a set of housing action resource agencies that are in every community, every county in the state. We created, and MISHDA really took the lead on this, right? Created a pretty streamlined process to determine eligibility, and people are able to access some help up to the median income in the state. And if the key with that was actually building off the success we had with energy providers, was to actually require forgiveness from the landlord. So taking that sort of assured money, if somebody proves to be eligible, the landlord has to waive all late fees and sort of penalties for non-payment, and cover 10% of the arrearage, right? And so then we'll have a clean slate sort of wiped away. Now, the big question in all this is 50 million enough? It's our take after a lot of analysis, right, that there may be non-payments actually going up, but actually all of the data we have suggests exactly what you just said about in the aggregate, not to say that there aren't a lot of people are hurting, but in the aggregate, the unemployment insurance especially, and combined with the stimulus, means that actually non-payment doesn't look a lot different we don't have great measures, but from the ones we have, non-payment doesn't look a lot different from where we were last year. And so if that proves to be true, then we think 50 million is enough for now. Now, none of us know what happens if there's no extension of unemployment insurance at the end of the month. And the two great things unemployment insurance did were expand eligibility, right? So that was sort of, I think, basically a statement about the fact that we know that unemployment insurance system doesn't work anymore. It's something Sandy Levin's been talking a lot about at the Ford School, because it doesn't cover remotely everyone. We just said, hey, we're going to cover everybody, and that it doesn't pay enough, right? And so that was the adding $600 per week to the benefit. And so that's all. The second piece of that $600, that's going to go away at the end of July. And we don't know what happens now. But the policy decision was to say, we're going to set aside $50 million. We're going to do a streamlined process, and we're going to try to clear the deck now and not keep the moratorium going. and then see where we're at in the next couple of months and make decisions based on that.
And I'm certainly mindful and hopeful that $50 million is enough. Again, speaking from a slightly more distant perspective around the policy world, my message to policymakers, to audiences more broadly, is that if individuals go homeless, that's an additional alternative problem that will involve additional external costs in some way.
Yep.
And so it's not simply a question of we met the needs of some families we did not. There will be issues that will follow. And so a moratorium on rent, a solution to the end of the moratorium, doesn't necessarily mean the end of needs, services that people will have to have if we don't have the corrective, the proper corrective in hand around the housing situation.
Yeah, I mean, Al, I think that's right. And, if you look at the situation a lot of people are facing in this country, we are still facing enormously high unemployment rates. If we don't get unemployment insurance expanded and extended by Congress at the end of this month, those people are going to be really out of luck. You're going to see flows through to evictions, to foreclosures on people who are able to own their homes, and all kinds of other things. So I want to loop back to the unemployment insurance in just a second, but I do have a set of questions from the audience about the earned income tax credit. And Al, I wonder whether you could talk a little bit about the role the EITC has played in the lives of families you've talked to in terms of providing a cushion for them. And, is it an important policy, in this crisis moment? The EITC for most people comes, only at tax time. How can it be made, more effective in this environment for families?
And I'm trying to think through that in the weeks that I've been at home dealing with the pandemic. The credit has been significant in that it has been perhaps the only formal policy in not just recent years, recent decades, that the people I study talk about. So I said earlier that there's always a consistent level of suspicion, a lack of trust, but the tax credit has been critical for enabling people to better make ends meet. Now, again, there's a lot of anxiety about whether there is long-term commitment in that kind of intervention. Right? And particularly given the political climate that we're in today, there are a lot of folks that have the attitude that this is it. Right? We'll be left on our own. There won't be that kind of intervention going forward. And I think, on the one hand, there's still a great deal more research to do around the effects that the credit has had upon people. I think it's been one of the most clear, salient, significant forms of impact that's happened in a long time for people. And I've been amazed by the extent to which people understand what that credit has done for them. They may not be as clear, as articulate about other forms of policy, but that's been a big bang, as I say in my research, on the ground, in the streets.
Thanks, Al. Luke, I know you've done thinking about both the EITC and how to make it more accessible to people. Maybe we had a very small advanced EITC for many years. It's gone away. Is there a way to bring that back? Or you've also been proposing a universal basic income. I wonder if you could talk about these different strategies and how they might help people coming out of this crisis.
Yeah. So I totally agree with Al that EITC is one of our most successful programs. And I think, my collaborator, Kathy Eden, her book really stresses that the EITC does come with dignity, right? It's one of the programs that provide income support to the families where they don't go into the welfare office, which is often not a very pleasant place to be, but rather they, file their taxes. What's more American than filing your taxes? Or they go to a tax prep place like H&R Block, where the motto is "You've got people," right? So there's a really dignifying piece of that. The downsides are the one that you two have already addressed. It only comes once a year. And the second is that it's totally tied towards earnings, right? So if your income falls to zero, your EITC falls to zero. So I don't think we can think of it as a safety net per se. The two elements that I've been a proponent of, I'm interested in basic income, but I am a proponent of what was a radical position a few years ago is now maybe a moderate position of a child allowance, right? Where
we may have temporarily lost Luke.
And that was getting very exciting too.
Yeah, we're going to hear more about the child allowance in a moment. Let me flip, Al, to you to talk about another idea from the audience, and one that harkens us back to the New Deal. In the New Deal, there were significant efforts put into jobs that were made available by the federal government. And the Works Project Administration and a wide range of other initiatives that FDR put into place. What do you think the role of public jobs provision ought to be now and in the future in terms of getting us out, helping low-income people get on a path here?
Well, I think it's fundamental in large part because public jobs, unlike jobs in the private sector, come with a degree of support, with a degree of accountability that often escapes the public sector. And what's been critical and I think understated in the discussions about employment have to do with not simply the quality of one's job, but what the economic returns on employment happen to be. And given that I've spent years studying African Americans who have said very clearly that there is a difference between having a job going to work and being able to even make basic ends met. That conversation is erased in a simple focus on employment statistics, right? Quality of work, the resources, the fringe benefits attached to work are of pivotal significance to disadvantaged populations. And I think we're more inclined to consider those prospects, more inclined to measure and evaluate the impact of work at a public jobs initiative. Now, whether the broader public is as accepting of that kind of initiative is another kind of conversation. But clearly where I stand, it's a critical way to go. People in meaningful work.
Historically, I know that, for example, African Americans made significant progress in the employment space through state and local government employment, through jobs in the United States Postal Service as a critical path for success. So I wonder whether we could, in part, establish better channels that will be kind of stepping stones for African Americans and others who have been left out of the labor market or are hardest hit by the current downturn.
I think we can. It's a question of public will. The difference between the New Deal era and now is that we often regard, even if statistics show otherwise, we often regard public initiatives as servicing disadvantaged people of color. So there's an explicit racialization to any kind of intervention in that way. The New Deal certainly benefited African Americans, but it was not created as an African American focused interventionist set of initiatives.
No, I mean, it mostly benefited white people, for sure. And, it's interesting, the earned income tax credit also in the 1990s was sort of attempted to be racialized by critics of the EITC, even though the overwhelming benefit goes to white families. Right. It was nonetheless, critics tried to make it seem like a welfare program for African Americans, which it just clearly is not on either of those two dimensions. Luke, we've been talking about public jobs as a strategy, but we kind of lost you when you were talking about the child allowance. So maybe you could finish up your thought on the child allowance, and then love to bring you into this conversation about public jobs.
Yeah. So the child allowance, and I just wanted to say the EITC and the child tax credit are the refundable credits that we have right now, and they actually are racially unequitable in that larger benefits go to white children and low-income white families because of where they tend to sit in the income distribution. The EITC benefit increases as earnings increase. And so if you have disparities in income, then it has higher, low-income white children usually get more than low-income African American children. So the child allowance is one way to, it tries to treat everyone the same. And so it's a same basic premise of guaranteed basic income, that it says, you know what, let's keep it simple. Let's just say everybody gets the same amount. And so that has the, on one side, it's not at all racialized. And I think one of the knocks against it right now is that we need to do things to address structural inequalities by race, right? And we need to do things to address racism. This doesn't directly address it. On the other hand, you could say, because it treats everyone exactly the same, right? Every child gets $250 or $300 per month. This is how we do it in other countries. We've seen huge child poverty reductions in Canada. They have like $500 a month for the lowest income kids. So my motto is we can be half as good as Canada. And it actually has like a racially equalizing effect of saying we're going to treat everyone the same. It gives us less of a chance to treat children of color not as well. So that's, the child allowance. It's been something I've been talking about a lot. And it actually 1 year of an expanded child tax credit that's designed in this way was included in the HEROES Act, which is part of, it's the bill that passed through the House of Representatives, and is sort of the start of the House of Representatives position as they think about the next COVID response bill. So we'll see what happens. It's never gotten that far to be passed through the House of Representatives.
I wonder whether we could spend a minute or so talking about this next crisis response, because Congress is thinking about it now. We've had some new indications that the White House may be open to another relief bill. Prospects in the Senate are uncertain. But what, if you had to pick just 2 or 3 things you want to make sure that Congress gets done in this next round to keep families from falling over the cliff, maybe we don't have a ton of time left, so maybe each of you could pick, 1 or 2 things that you would want to be sure that Congress is thinking about right now as it's contemplating that legislation.
So I'm going to go a little bit outside the box and recognize a lot of people are trying to make comparisons between recent history and particularly the 2008 recession and the present moment. And I think what stands as distinct for the present moment is that if we don't fundamentally come to terms with this health crisis, then we will have this serial return to investigating relief efforts over and over again. And I think that shapes a very different moment. So as much as I am focused on what Congress may or may not do around the next phase of relief, if we don't come to terms with more formally instituting mechanisms and mandates for public health and safety, the economic crisis will endure. And so I would argue that we just be cautious about how we order an approach. And quite frankly, I've been disappointed in a lack of a federal government initiative that over the long term targets public health around this crisis. The statement now is just open America. That does nothing to advance us around the public health front. If we don't do that, the economic crisis will endure.
Yeah, I certainly agree with that, Al. I mean, it's hard to imagine us getting to a real recovery when people are still rightfully fearful about engaging in economic life. And the federal government response to this has been really dismal. And the state response to it has been, in some places, really aggressive and fast. New York, Michigan, in other places like Texas, Arizona, Florida, the state level response has been really quite bad. And you're seeing that play out unfortunately in the numbers we're seeing. Luke, where would you head next in Congress?
Yeah. So I think 2 points. The first really aligns with what Al said, with a focus on the sort of the economic, dealing with the economic crisis. I'd just like us to think longer term about this, right? So if we did another stimulus check, the issues would be fewer, but there would still be lots of issues, right? So what if we did the next round thinking about like, how can we put the scaffolding in place to where round 3, right, down the road, if we need to do one, it's there, and we can just immediately get people money, or we can get them, you know, whatever the benefits are. Or with unemployment insurance, how can we really start to put the scaffolding in place so that people aren't waiting on hold for forever and ever, right? So thinking sort of longer term versus like one Band-Aid in the moment. And the last thing that I'll just say is a big thing for me, that I think we need to think very, very specifically about families with children. Maybe this is a selfish thing, having, you know, kids myself, but I think there's like a double, triple, quadruple bind for families, right? And it's very low income families with kids, but it's, you know, up the income ladder too, of like, what are we going to do with schools? Let's say schools open or they don't open, you know, with reduced density, right? This is a huge strain on families. And, you know, just thinking about the stimulus check, I was upset that the stimulus check treated every adult $1,200 and every kid $500, right? So I'm like, are children really only, you know, less than half of an adult? So I would like us to do something concretely. Hopefully it's the child allowance, but other things too, to say, let's really address the challenges facing families with kids who are impacted in the labor market, as well as with schools, you know, as well as many other ways.
Al, I wonder whether we could broaden this out. We've had a summer not only dealing with COVID-19, but also a summer in which there is some renewed focus on long-standing issues of racial injustice in our society. And I wonder if you could say a little bit about what this moment might mean for us as a society, and whether the moment might turn more into a long-standing movement, what it would take to not just have the protests, which are so critical in calling attention to these issues, but also translate that into long-term movement on these issues that have been in our society for so long.
Certainly. I will say in the first case that the pandemic has given us, quite literally, an opportunity to be at home and spend time thinking. And so the fact that these other developments around race have unfolded have given lots of time to think deeply. And what I encourage the public to do is to not simply think about what might endure over the long term, but how investments at the personal level might, in fact, in aggregate form, contribute to long-term change. I invite people quite briefly to think about where they live, where they work, where they go to school if they're in school, where they worship if they worship, what formal spaces would they engage recreational activity if sometime in the future they can continue to do so. Those are 5 sites where you can ask yourself 2 basic questions. In what ways do those domains unfairly exclude people that should have access to them, either by the social arrangement of those spaces or the cultural practice that go on? Where might people be unfairly excluded? Second, where might people who are included in any of those domains feel unable to enjoy the fruits of those spaces because of the practice that go on there, because of the arrangements? If every individual thinks about taking action in at least one of those domains, that's what leads to long-term engagement and substantive solutions around our race problem.
That's great, Al, and that's exactly the direction I was hoping we could go in these last minutes here. So, you know, what is it that people who are listening can do directly? And I think you just listed some really terrific examples of how people can make a difference on the ground in their own communities, however defined. Luke, I wonder whether you might answer the same question in our final minute here. What can people listening do?
Yeah, I really like that framework, and saying, you know, I tend to think of things of trying to look at the long-term trajectory. How do we change things? in a meaningful way that make a meaningful difference for families. And but also looking at that day to day and saying, how do I live my life, and what does that mean, right? And what systems do I come into contact with? Come into contact with schools, right? If folks do, how are my children affected by what's going on? What about the children of other folks in the school? And what can I do to make sure everybody has access? I know for me at Poverty Solutions, we're trying to take a really close look and think about how we can better live into the work of confronting and combating racism, institutional racism at the university, in the systems that we have connections with. And so Al and I and Earl Lewis at the Center for Social Solutions and Kristen Seefeld are developing an RFP where we're going to be trying to fund and really support a set of research that tries to take concrete, actionable steps on how to do that at systems levels, hoping to release that in the next few weeks. And I think we can all just sort of try to do the same process, right? And say it starts with us. And let me think about, is there something at the end of this week where I could say I did something that, in some small, medium, or large way had an impact on combating racism?
Well, we're out of time. Unfortunately, I could have a whole afternoon with all of you here. Thanks to those of you who were able to join us online in the various social media platforms. A real special thanks to Al Young and Luke Shaefer, professors at the University of Michigan, for joining me this afternoon for this policy talks at the Ford School at the University of Michigan. I hope all of you were able to enjoy it today. Please stay tuned. Look at the Ford School website for upcoming policy talks. We hope you can join us another time. And until then, please stay safe and stay healthy. Take care.